Human Services Committee to order. Thank you for being here today. First item on the agenda is its approval. Chair will entertain a motion for approval of the agenda.
Support.
Thank you, Commissioner Snell and Commissioner Williams. Any questions with respect to the agenda? All those in favor will please say aye. Aye. Any opposed? Very good, thank you. Next item on the agenda is public comment. This is the 3-minute public comment. Is there public comment? Is there public comment? Last call for public comment. Public comment is now closed. We move to committee items. The minutes of last month's meeting, the chair will entertain a motion.
So moved. Support.
Thank you, Commissioner Snell and Commissioner Willis. Any questions with respect to the minutes? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. We now move to the painful topic of appointments. We have 3 vacancies, 2 on the Sanitary Code Board of Appeals and 1 on the Department on Aging Advisory Council. We have had no applicants. Are there any nominations from the floor? The chair will note that I did contact another of the Home Builders Association to see whether they had any members who were interested in the Sanitary Code Board of Appeals, and have had no response from them either. Hearing no nominations, we will continue to advertise the openings. Moving on now to the medical care facility and its financial report. Not seeing anybody here from the medical care facility. Thank you. Is there support? Thank you, Commissioner Snell and Commissioner Williams. Any questions? All those in favor will please say aye. Aye. Any opposed? Thank you. We now move on to Wellwise and their draft annual implementation plan. Madam Director is here, I see. Pass that down to Commissioner Bear. Welcome.
Good afternoon. Nice to be here today. I want to introduce Nicole Baker, who's our Chief Services Officer, and she's very instrumental in the plan, and so she's going to do some of the presentation today, but I will start it off. So I'm not sure how we advance this. Does somebody have control over the advance? Okay, okay. Well, I'll get started while we're getting to the first slide. So what is an area agency on aging? The Older Americans Act of 1965 created area agencies on aging throughout the country. And in the state of Michigan, we have 16 area agencies on aging. So every county in the state has an area agency on aging. Some of us have different names like Wellwise Services, Area Agency on Aging. There's others called Senior Resources, Senior Alliance, and others, but we all are designated as area agencies on aging. So Jackson County, we were established on October 1st of 1974, and we serve Jackson, Hillsdale, and Lenawee counties. So our primary activities include related to, the being an area agency on aging is advocating on behalf of older adults and adults with disabilities and their caregivers, identifying needs of older adults as well as people with disabilities and caregivers, and making sure our plan works to meet the needs. And, we develop a system of in-home care and community services to help folks maintain their independence and dignity. We work with local contractors like Jackson Department on Aging, and we work with the departments on aging in each of the other 2 counties as well. And then one of our big pieces of work is administrating, the federal, state, and local funds as well as private funds to support the services that are approved in our plan. So most of our or a large portion of our services are put out in the community through contracts and purchase agreements with local providers. So, you know, in Jackson County, it's Jackson Department on Aging. We work with Catholic Charities, and then we also work with Legal Services that covers all 3 counties. And then we continue to provide, you know, community-based services throughout Jackson, Hillsdale, and Lenawee counties.
Okay, so I like to use this slide because it's a nice visual of how funding flows to area agencies on aging. On the federal side, you can see on the slide, this is how the funding flows. Area agencies on aging, as Julie said, sometimes look different, especially in different states. But in the state of Michigan, as she said, we have 16 AAAs, and the 16 AAAs receive guidance from ACL, from the Administration for Community Living. But most of the time, we work directly with our state unit on aging, which in Michigan is the ACLS Bureau. The state has changed the name of that bureau many times over the years, so you may have heard it previously named something else, but currently it's housed within MDHHS and goes by the acronym of the ACLS Bureau. Next slide, please. Thank you. This slide shows the multi-year planning process. So this is put in place by the Older Americans Act at the federal level, and then there is some room for changes at the state level, as I said, through the ACLS Bureau. And this is the planning process that area agencies on aging just repeat. So typically, a multi-year planning process is 3 years. However, the state actually amended it this time so that it would actually be for 4 years, so that it would line up with some dates of other plans that they have to submit on behalf of the state. So currently, we are in step 6. Which is that we are pretty far into our multi-year plan. The area implementation plan, which all of you have a draft copy of, that is our opportunity where it says here in years 2 and 3 to make some kind of minor adjustments to the overall multi-year plan. So that's where we are right now. But leading up to the multi-year plan, there's a lot of work that goes into that, including community focus groups, a large community needs survey, and then also a request for proposal process, whereby contractors can bid on the services that are deemed necessary in our service area as a result of the community needs survey and then those focus groups that I mentioned. Next slide. Thank you. And then I wanted to highlight a little bit about the way that our budget for the Older Americans Act funding is structured. It can be rather complicated. There are about 10 or 15 different fund sources that all fall under the Older Americans Act, or OAA, if that's a term you're familiar with. But every year it starts out usually around February. We receive an estimated cost allotment worksheet, which is essentially just a big worksheet that shows how much every area agency on aging is going to is estimated to receive for the next fiscal year based on each of those fund sources that I mentioned. So those numbers are very estimated. There's usually what goes into it is the state makes their best guess at based on the previous year's funding and whatever information is available to them to decide how much they think that we should all plan to receive in the following year. And then, so currently in the budget process, we're in step 2, which is that we've submitted our preliminary AIP budget. That's what went to the state in June. And then it goes through many levels of approval at the state. And then actually Julie and I will be presenting to the Commission on Services to the Aging, which is a governor-appointed body that approves, among other things, annual implementation plans from AAAs. And then you can see steps 3 through 5 are opportunities to make adjustments, which usually we make a lot of adjustments because we have to, we have to submit our budgets without actually knowing from the state or the feds how much money is actually going to be received to all the different AAAs. The other thing to note too is that the funding that's associated with that AIP, the Annual Implementation Plan that you all have, it pertains only to Older Americans Act. It does not pertain to maybe like supplemental nutrition funding that, like, for instance, the Department on Aging receives pretty frequently. And then it also does not include any of our other revenue streams, like say from the My Choice Waiver Program. Next slide, please. And then we don't have to spend a lot of time on these next two slides. I just wanted to give an opportunity to see the way that we work in tandem with our contractors. So you can see on this slide, these are the services that Wellwise offers directly. So these are services that our staff perform. And the next slide, please. These are services that are contracted, once again, using those Older Americans Act dollars. So this would include, of course, Jackson County Department on Aging, but then also the Lenawee Department on Aging, Hillsdale County Senior Services Center, Catholic Charities, and then the Michigan Advocacy Program, which provides legal services and long-term care ombudsman services. Next slide. So I mentioned that we do have a requirement from the Older Americans Act as well as from the Older Michiganians Act at the state level to elicit feedback from the communities that we serve. We do a lot of, as I said, focus groups and things at the beginning of the multi-year plan cycle, but at every year point within that cycle, we also hold public hearings. So this is just kind of a quick snapshot of the general topics that were talked about at this year's public hearing, which, as you can see, was attended by 22 folks and was held at our office on May 21st. In the annual implementation plan, there are more thorough notes about the responses that were received that day, but for today's purposes, these are just some topic areas. And next slide. So we would be happy to answer any specific questions that you have about the draft plan or anything else.
Questions for Wellwise? And the action I think that we are looking to take today would be to recommend to the full board its adoption. Is that right? I think that's right. I'm opening up there. Okay. Motion and support to recommend to the full board the adoption of Wellwise's annual implementation plan. Any further questions? All those in favor will please say aye. Aye. Any opposed? Thank you for presenting it today.
Thank you.
And now Danielle with the monthly report for the Department on Aging. Last I saw you was at the fair.
And I was going to mention the Senior of the Year that was presented last Monday, how fantastic that was. Sunday, sorry. We used to be a Monday, now we're Sunday. But it was a great day. It was a little bit warm, but American One had a tent ready for us. The music was great that they were able to bring, the fair was able to bring. But Pam Spurlbaum and Tredna Oren were very appreciative of the being recognized. They actually sent in letters just showing their gratitude for people showing them how much they appreciated all the time that they spent volunteering. So that was one of the first times we've gotten letters from actually both recipients of the Senior of the Year. So we're thankful that the board was able to help recognize them. It really did mean a lot to them, and we got some great pictures that'll be in our upcoming newsletter. We're currently working on our senior safety seminar. It'll actually be on September 17th. And we're able to help promote this program through some funding that we received from Wellwise Services. So we were awarded $1,600. And with this funding that we're able to use, it'll help pay for advertising for the event. It will allow us to do a few different giveaways. The seniors always seem to enjoy those. So we'll always try to keep it senior safety related items when we have things for that event. So this year we have these great credit card sleeves that are supposed to protect your cards. So every person that comes to the event will receive 2 cards. They're easily to find them, easy to find in your wallet or purse because they're color coded. So somebody can definitely put their cards that they are worried about getting, I think where they're able to like scan it, like when you're shopping. And these credit card sleeves will help protect that information so it's not taken. We're also able to purchase a safety whistle. I will not blow this because it's very loud. So whether somebody, when you think about upcoming holidays and you think about you're in the parking lot or you're going for walks, even, on our, within our parks or just in general in your neighborhood, and you worry about safety and being able to draw attention to yourself, so that if something were to be happening, that you can get others to notice that. So these will be 2 giveaways for that event. With that event, we're also able to have ProShred on site, and they'll be doing record disposal. And we had a senior call earlier in the year, and they were from the Rives Township area. And actually, the township office had called and wanted to see if we were going to have an upcoming shred day. And they had given our name to that senior, and that senior actually followed up and said, "Are you guys going to be doing anything?" And we shared, of course, the seminar that we had coming up and the shredding company that was going to be there, and they were very excited, and they were going to call their township office back. So we hope to target about 70 people. It's a great opportunity for us to not just provide some of that safety information, but also to highlight our congregate services. So we'll be serving a senior meal before that, so people can come in, enjoy a great meal, sit down, and then, hear a great presentation from the undersheriff. So we're thankful that he's able to take that time, come and present to the seniors in our community about public safety, what things that they should be aware of when they're out in the community, and different scams that they're aware of in the area. So I think you'll get lots of questions, and I think we'll have a great turnout, so we're pretty excited. We're also beginning Medicare de-enrollment. So even though you say that open enrollment period starts in October, it actually starts right now for the Department on Aging. So we're fielding a lot of calls for people wanting to schedule their appointments. These will go up and through December 7th. So we schedule those with our volunteers, and they will sit down one-on-one with individuals in the community that want to compare their plans, make sure they're in the right plan, the one that's most cost-effective for them, to help them keep their resources, their financial resources that they definitely need to stay in their home. So if you know of somebody that is looking for assistance with that, they can definitely reach out to our department. I also attached our statement of contract award. Wellwise had just spoken, and with that, you have the most current statement of contract award, which goes through 9/30 of 24. So that kind of shows you our allotment of funds from Wellwise Services. So we're greatly supported through the grants that we have with them. There was a small decrease in the NSIP, but we were very thankful for the other funding that we were able to have come through this year. I've presented earlier that we had the additional ARPA funds that were awarded, so that kind of helps to offset some of those differences that came about with this final contract award that we have right now. Also with that award, we'll bring another one once their board makes the approval for what on that contract award. There's something called C1, C2 federal funding for congregate and home delivered meals. We did ask for a budget transfer between those 2 funds that was like $131,000. We definitely see a higher need for home delivered meals, for that funding to go into that area, and we were able to get awarded that full amount. It's been approved, but it has to go through the full process yet. So I'll be bringing an updated statement of contract award when all that comes through. I also then shared a community member note that was received by our department, and this was from an 86-year-old individual who her daughter, who was 65, received home delivered meals. With that note, the mother was just sharing how much the program helped her live independently a long time in her home. The daughter did pass away in a nursing home from congestive heart failure, but the meals really helped her live independently at home for a long length of time, and she was very appreciative of that. You'll note on there in her note that she talks about she wasn't sure if her daughter had paid for the meals. And again, Meals on Wheels is donation based. So even though she sent a contribution in, we wanted to make sure that she was aware that this was not a program that had to be paid for. She wasn't sure if her daughter was able to afford that and if she was able to donate, which we can't share that information, but we can definitely share how the program works on donations and if she still would want to go ahead and make that contribution. So we didn't want her to think it was a paid service. So, but a very thoughtful letter. Again, you always think that it's children that are taking care of their parents, but on the flip side here, you have this 86-year-old that really found the program to be helpful for her very own daughter. So, and that's all I have. I can take
Questions for the Department on Aging? Commissioner Willis, please.
I'll say, Danielle, we appreciate the services that you all provide. As you know, I spent a lot of years at King Center. That's one of the congregate sites, right?
Yes, it is.
Yes, and to this day, so many seniors, we actually go back and take a trip with them every year. But they meet there, they play games, they do crafts, and they have a social place to meet. So it means so much the service that you're providing, as well as the meals to the houses for the senior citizens that are in need. It's greatly appreciated, what you all do.
Yeah.
Thank you, Mr. Chair.
It's a great collaboration with the city to be able to do that.
Very good. The chair will entertain a motion to receive the report. Commissioner Bear, thank you, and Commissioner Snell, thank you. Any further questions? All in favor will please say aye. Aye. Any opposed? Thank you. Thank you, Danielle.
Thanks.
And now, with respect to the Human Services Building, the generator question.
Good afternoon. I have a couple items on the agenda today. The first one is a request for approval to purchase 2 generators for the Human Services Building. 2 generators totaling $84,605. We were fortunate enough to have still be using some of the COVID-19 immunization funding. Went through approval through the state to get these funded for their purchase. So I'm just looking for a purchase or approval for that today.
Questions with respect to the proposed generator purchase? Chair will entertain a, you have a question, Tom?
I do as well.
Go ahead, Commissioner Bear.
Thank you. The installation is going to be provided by our Facilities Department.
Correct.
Just a question on the funding there. Was this generator purchase known far enough in advance that there is a specific line item for this installation? Or is this just in their general funding?
I believe this is just in their general funding. We've been working on this since about January. Approval for the state took a long time. Approval for, getting it, what exactly they will cover, the specifics, and they will literally only cover the purchase of the generator, not, the concrete to set it on, the installation of it. So that's where we'll use our facilities. The facilities funding has agreed to support the rest of it. Partially because, I advocated for that, and Derek and Rick at that time, we talked about, putting new generators in there to cover the clinic and our freezer and refrigerator spaces, that we have to keep our immunizations and all of that cold and held. That will take, load off of the rest of the building and the other departments. It will not only help the health department, but it'll service the other departments that are in that building as well.
Okay, thank you.
Chair will entertain a motion to adopt the management recommendation. Thank you, Commissioner Snell and Commissioner Bear. Any further questions?
Mr. Chair,
Commissioner Williams, please.
thank you. My question on this project is for administration. Will this purchase interfere with anything that we're doing with our Verigy project?
No.
Okay, thank you. Nothing further, Mr. Chair.
Okay, anything else? Okay, all in favor will please say aye. Aye. Any opposed? Thank you. And now the Cycle 8 review accreditation issue.
Yes, Jackson County Health Department, all health departments in the state have been going through Cycle 8 accreditation for the last year and a half. It is our turn. We are up in November. They will come in and review most of our programs in November. One of the very first steps of that is to provide them a plan of organization. This just has a lot of documents. I created them in attachment form online, so you can click on them and not have to print out 150 some pages to look at them all. But basically just proves, that we are doing the things that we're doing and we have the appropriate staff, we have the appropriate partnerships, and all of that. It is due by mid-September, and this also has to have plan approval, and there's an approval form that needs to be signed by the chairperson, so I'm just asking for approval of this plan.
Questions with respect to this issue? Chair will entertain a motion to adopt the staff recommendation. Thank you, Commissioner Bear and Commissioner Williams. Any further questions? All in favor will please say aye. Aye. Any opposed? Thank you. And now the monthly report.
So we have here my standard monthly report, going through just highlighting a few things. Starting again first in the community health education and promotion. Seems like just yesterday I was standing up here saying that the school year had ended and a lot of our school programs have ended. And here we are gearing back up, in multiple programs about getting back into the schools. So community health education, we did finish up some of our summer programming with our Empowering Youth Today program. One thing to point out, the opioid RFP, that deadline was it was August 2nd. We have a review team that is actually meeting this afternoon to go over the scoring tool and how to use the scoring tool. We received 3 proposals from the community, and they will review those, provide scores. We will come to you next month with the review of that and our recommendation for that, but provide you with those proposals and what they were. You'll see there's been a lot of work in the community. We've been a lot of different places with our health resource advocates, partnering with the city and things, or participating in some of the city events. We've been at the Dahlem Center. There's been quite a few hand washing and nutrition education and hygiene. We're at the Summer Safety Series. Our Empowering Youth program today, their Get Real program was a success this summer. We received quite a few compliments from community members, including the church that we host that in, and how well the program was organized and ran this summer. So we'll continue. The other thing to point out about Empowering Youth Today is during that Get Real program, Get Real goes Tuesday, Wednesday, Thursday, but our health educator was out on Mondays teaching as well. She was, we created for the first time a partnership with the youth center, our county youth center, and brought that teaching and those educations into the youth center. That program just ended in the last week or two, and I think we'll re-look at it and talk to Chuck Baker over there and see, what his thoughts were on, and see if we continue, some of that programming there. Again, just prepping for the school year, a lot of talk about that, even as we go into the personal and preventative health services. This month, I put in here, it's kind of small and probably a little bit hard to read, but a calendar. Some of our staff in the immunizations department really looked at some of the things that were needed in the immunization program when it comes to back to school. We try to be at all of the kindergarten roundups and all of the events, back to school blasts and things like that are posting, so we can be available to talk about immunizations, look up childhood immunizations for parents that might be there. But one of the things that was noted from last year to this year, especially with a new coordinator coming in and looking at things, was the expansion of our hours. So for 2 weeks, beginning today, the next 2 weeks, our immunization clinic will be open for 10 hours each day from 8 a.m., except for Wednesdays, but Monday, Tuesday, Thursday, Friday, they will be open 8 to 6 p.m. And then Wednesdays, they will have their normal hours. They are alternating staff to accommodate that schedule, to try to make sure that we're available and have hours operational for parents to bring their kids in to get those immunizations. Going forward in personal and preventative health, like I said, we've been a lot of back to school events. Lyme disease is up, so looking at communicable disease, Lyme disease compared to previous years, we have, where is it on here? 15 cases. As of July 19th, we have 15 cases have been identified in our county, and that's an increase from the past couple years. Another thing to note that I know previously talked to Commissioner Shotwell about was we have been working to collaborate with the animal shelter. We work with them on our rabies cases, so when bats come in, on who gets those and sends those off to the state, so we don't have community members wandering back and forth between the animal shelter and the health department. So we've been working with our process there to streamline that and make sure that we're all on the same page with, new employees at the health department and new employees at the animal shelter, that we make sure that process is streamlined and known by all. WIC continues. Environmental health programming continues, still looking for an environmental health director, have received very few applicants. We're also in competition with Branch Hillsdale St. Joe. They are also looking for an environmental health director. At this point, I don't have qualified applicants, so we will just continue to keep that posted and continue to reach out to state organizations to try to do that. In the meantime, we have a couple great coordinators down there who are keeping all of the work going, and then I'm working on kind of those special projects things. Two things to note that we are sitting on with the state is the PFAS Michener site on Mechanic Street. There's the Superfund and some planning and information to the community coming at the end of the month. I will sit on that with the state. And then there's also some well water sampling going on in the neighborhood east of the airport, checking water samples. We are just kind of a liaison with that, trying to be the community partner that if anyone has any questions or wonders why these state, employees are walking around trying to test their water, we can, reassure them what's going on, so.
Since we're talking about environmental health, can you explain how the health department is either assisting or is not involved in the algae bloom at Vandercook Lake?
First, I was notified by the state that it is not a harmful algae bloom. It is an algae bloom, but it is not a harmful one. The toxins that are in there are different. So we simply take the information and send it off to the state. The state is the one we take pictures. We had our Parks Department take pictures. We sent those pictures off to the state. They look at it. They determine if they're going to come down, and they're the ones. The state is the one who will test and determine. And then we serve kind of as that liaison. We will put advisories out. We put in an advisory out for Vandercook as soon as we knew that there was something there, just saying there's a potential and avoid that area. And then if anything else if it had turned out positive or they had discovered anything, we again would have, helped and changed that messaging to the community. Not that I'm aware of. It is only the harmful algae blooms. Even if it's a harmful algae bloom, it is only if you are not in that section. From everything that the state has told me and that I have learned over the course of the last couple years, is that as long as you stay away from that specific area and you swim in the clear water, you are clear and you will be safe.
Using our 911 connection where we send out the automatic call.
Yeah, we talked to them.
Well, to explain to people that it's not harmful and that, just to let them know. Because
have
I'm
not
getting
thought about it
all
that
kinds
way.
of phone calls. That's why
Yeah.
I'm asking.
I have not thought about it that way, but that's a good point. I'm actually meeting with Jason Hammond from 911 and Corey Kubik from Emergency Management this week sometime to talk about that, to make sure we're all on the same page on how those alerts can go out and when they could go out. And, now that you bring that up that way, I was originally thinking we would only want to send something, we'd only want to alert the community if there was a problem, but I do understand. So we'll talk about that for sure and see, what the best way. What we don't want to do is cause panic and cause people not to go to the Vandercook Lake Park, because there is plenty of water there that from everything we know that it is open. But I, too, am in communication with the
Who I'm getting
parks.
phone calls from are residents on the lake who want to know if they have to, it's really gotten convoluted because they don't know. And what I mean by that is now they want to know if they're going to be assessed for getting the water cleared up, and you know what I mean? It just,
And it
things get out of
doesn't.
control when we don't
Yeah.
We can't get some facts out to people.
Yeah. And really, the cleanup for that is really, a windy day and some good rain that kind of unfortunately washes it. They don't do a lot, but it washes it away. So some heavy rains and some cooler, windy weather kind of takes that away. But yeah, we can definitely talk about that, because that Genesis system I know does have that ability to target those specific, areas. So
Further questions for the Health Department? Thank you for being at the back-to-school blast on the 25th. My wife was coordinating that. That was a very busy day, and we appreciate you being there.
we have a new outreach coordinator, and that has, like, the number of events and the places that we're able to be has, because she's specifically there. So if, individual program staff can't be there, she's able to be there, which has been a really nice component to the health
Very
department.
good. Chair will entertain a motion to receive the Health Department's report. Thank you, Commissioner Willis and Commissioner Williams. Any further questions? All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
Now on to the claims. Chair will entertain a motion to pay the claims. Commissioner Snell and Commissioner Williams, thank you. Any questions on the claims? I think, Commissioner Berry, you were the last one. Maybe, have they made them? Very good, very good. All in favor of paying the claims will please say aye. Aye. Any opposed? Thank you. Please take note of other minutes that are there, the DHHS board meeting minutes and the VA meeting minutes also. Reporting schedule for September. Department on Aging, the Health Department, DHHS, the Medical Care Facility, MSU Extension, and the Medical Examiner will be here. Busy month. We're up to public comment. Public comment is now open for 2 minutes. 2-minute public comment. Any public comment? Last call for public comment. Thank you. Public comment is now closed. Now committee member comments. Committee member comments? Hearing none, we will stand adjourned at the call of the chair. Thank you.